So as we discussed before, I think you are wanting for me to reduce that grooved area. We call that the nasolabial line. It's the line that goes from the base of the nose and extends to the angle of the mouth.
Yes.
The other thing that we discussed was the lack of fullness, if I can put it that way, of the lower cheek area. So if I could bring that out, then you'd be happy with that?
Yes, I'd be very happy with that.
What I've done at this stage is I've injected a little bleb of local anaesthetic just at that little spot where it's red, and I've done it on the corresponding side, and I've put a little bit of local anaesthetic just on the inside of the lip. This is to provide comfort for what I'm about to do. That is an optional thing. Some people prefer not to have local anaesthetic. While that is working, I will now inject the muscle relaxant. I will put 3 injections, one at 2, 3, 4 o'clock. Sometimes an injection is placed at 5 o'clock to get rid of what we call crow's feet, the radiating wrinkles from the corner of the eye. We do not want to come any further, because if we do, and too much is put in, then the eyelid will drop. Okay, so what I'm about to do is use a dermal filler, a skin filler, using that little red spot as my starting point, and I will fan out to fill in this area that seems a little depressed. As I advance, I inject a little, and as I come out, I inject a little. This is purely a movement of judgment as well as feel. And as I'm doing this particular filler that I'm using, I mould as I go, to make sure that we achieve the result that we're after. I'll just inject a little more, and then I will get Sue to have a look just to see the progress, because the whole idea of this is to have the patient achieve what she wants, not what I am thinking is best for her. It's what she wants, and I've got to meet her expectations. Now, at this stage, what I'll get you to do, Sue, is just grab the mirror. Can you just see just a little bit of fullness starting up just in this area?
Yeah.
You see that?
Definitely.
Okay. Now, we need to come into this lower area here, and then I'll let you have a look, and then we'll go again, bit by bit. The beauty of this filler that I'm using is that it is totally manipulative, and I can show people the final result there and then. They don't have to massage, they don't have to do anything after I've finished. The result will be seen immediately. One important point that I point out to the patients is that as soon as I have finished using the dermal fillers, they will feel a hardness or firmness just under the surface of their skin, and this could last for about 1 week to 10 days. It then begins to soften and feel just like their own skin. As for the muscle relaxant, it sometimes could take 4 to 7 days just to start to create that relaxation that we're after. So I always stress to people that they will not see their results immediately as they do with the dermal fillers. They must be patient, but ultimately the muscle will, or the muscles will relax. Hi Sue, how are you?
Good, thank you.
Yeah, it's good. And how did you go after the treatment?
Oh, it's wonderful. I'm very happy. Yeah,
Oh,
I've
lovely.
noticed a softening of the lines here, my lip, my crow's feet, my cheeks are all filled out. It's just, I feel really good. It's just an amazing job.
Okay.
So Dr. Kerry, how long will both products last?
Well, as I told you, the lighter product which I used in the nasolabial lines, are the lines from the nose down towards the corner of the mouth, and in the lip itself, that will last on average about a year, and the heavier product, which was mainly in the cheeks, on average lasts about 2.5 years. I think the most important thing that all people must realise is that it is essential that you learn about the products that are being used, how they work, how long they are going to last, their side effects, and how it's going to help you improve your appearance. That is the most important thing. And of course, it is then up to the doctor to make sure that they can achieve the expectations of the patient. I would now encourage you to look at the following video to help you in your education and understanding of the products that I have been talking about.